It is currently estimated that every 5 seconds a new case of Alzheimer's disease is diagnosed. But with the rise in global life expectancy, we are building an increasingly large elderly population, which means that today's 5-second pace could accelerate to just 2 seconds by 2050. Therefore, finding a cure for Alzheimer's is imperative. But how is it possible that no treatment has yet been developed for a disease that directly or indirectly affects so many of us? Well, Alzheimer's is very complex. We don't know its exact origin or its specific cause, but what we do know is that it gives rise to multiple pathological processes. It's not just a single molecule in a specific metabolic pathway that's affected. We are dealing with a multifactorial disease. So far, and unfortunately, approved Alzheimer's treatments have shown low efficacy, perhaps because they target only one specific pathological event, without addressing the disease in a holistic way. These approaches, therefore, may be too simple for the complexity of Alzheimer's. And that's why, in our lab, we propose an alternative that, instead of being simply simple, is rather simply complex. After identifying 3 proteins with different but crucial therapeutic effects for Alzheimer's, we have physically fused them all into one. In other words, a new protein made up of these 3 subunits has been designed and generated, thus combining the therapeutic effects of each of them into a single molecule. This is how Eve was born, named after the Greek goddess of rejuvenation. With Eve, our goal is to not only address age-related cognitive alterations, but also to strengthen the vascular tissues that supply the nervous system, as well as to regulate the immune system within the brain. In short, we are addressing a wide range of complications with a single protein. But beyond that, the simplicity of Eve gives it another layer of complexity, as we've seen in our preliminary experiments that combining the 3 proteins into one provides synergistic effects. In other words, the 3 subunits together have a bigger impact than they do separately. Finally, to get Eve to the brain as simply as possible, we have opted for a gene therapy strategy, which allows for long-lasting expression of our therapeutic agent with just one simple administration. And what's worth highlighting is that our gene therapy approach is based on the use of a specific AAV serotype that can cross the blood-brain barrier, allowing them to efficiently deliver Eve to the brain through a minimally invasive manner as it is an intravenous injection. So, in conclusion, this is the foundation of our strategy. To put it simply, we present Eve in all its complexity.